would like to invite the next speaker, my friend from Philippines, Carlos, Professor Carlos. Is there?
Yes, I'm here.
Hello,
I'm
Carlos.
going to prepare my presentation now. Give me a few moments. Okay, can you see it?
Yes, we can see it. You can see it's very community response from different countries, Philippines.
Yes. So if I may begin. Okay. So prior to the pandemic scare in the Philippines, I would like to take note that on January 12th, a volcano erupted in the Philippines, and it caused a shortage in masks, specifically N95 masks. So even before the pandemic in the Philippines, the N95 masks were in shortage because of the Taal volcanic eruption. So if you can see, donations were being requested for the face masks. So now let's go to the pandemic. So how did the community respond to the infection control measures? The Filipino community in the late January and early February 2020 was already hearing the news about the Wuhan virus in the international news. There are voices in social media actually asking for the declaration of travel ban, especially from tourists coming from China. So that was January and February. And then on March 6, 2020, there was an identified positive case in a very popular mall in Metro Manila, which is Green Hills. And this was a very congested mall, and immediately after the news of the positive case, you can see that it became a ghost town in a few hours. So declaring a community quarantine was done mid-March, I think about March 13. Cooperation was easy because of the pandemic scare. The people are already scared, no? So most salaried employees welcome this opportunity to stay at home with their family and weather out a few weeks, just staying at home. However, for many who have no stable sources of income, the problem is how could they provide food for their household during the interim? So the quarantine was followed nevertheless because of the several checkpoints and closures of public transportation. This is what forced the community to stay at home. Supplies of masks and other PPEs were immediately depleted. The University of the Philippines had to make an advisory on who should or should not wear surgical masks, N95 masks, and other masks. So initially, because of the limited available masks, the university made a statement that N95 masks will be for healthcare provider use only, and for the other masks can be for public use. So this is an example of the information dissemination of the university. So those who are in need are mainly the healthcare providers. No? There were also depletion of disinfectants such as alcohol and the like in groceries and stores. With the high price of the remaining PPEs and depletion, some concerned citizen groups and 3D printers actually. There are a lot of non-government organizations, a lot of Good Samaritans who donated masks and who manufactured face shields, 3D printed face shields. That could help the country's response, that could help the country's healthcare providers in responding to have adequate protection while on duty. And the community did their part by staying home in order to prevent virus spreading and help flatten the curve. So how did the community respond to social distancing measures? This was the, information dissemination done in the country. They tried to explain what is the epidemic curve and how to flatten the epidemic curve. No? So this was shared in social media. This was shared by the University of the Philippines and other institutions, and explained that in order to respond properly, we have to minimize those exposed. So if you can see that the hospital capacity, we tried to flatten the curve so that the number of patients arriving would not exceed the capacities of the hospital. No? So this information was disseminated to the public, and this is the current occupancy rate of hospitals in the Philippines, talking about ICUs. No? So we did not, what do you call this? We did not overwhelm the hospital ICUs because of that. So in a way, you could say that we did flatten the curve. Now, so in terms of the community quarantine, the Filipino community, especially in cities, are congested. For example, here in Manila, the population density is 45,000 people per square kilometer. So it was very difficult to impose physical distancing because of this congestion. So the key to this success was the community quarantine. It prevents people from leaving their homes. It leads them, preventing from them being in close contact with others that could potentially transmit the virus locally. So why quarantine? The government cannot declare a lockdown, because if you declare a lockdown, the government needs to bring food to every household. That's why it was only community quarantine. Now, in this community quarantine, everybody was required to stay at their homes, but one person is given a permit or a pass or an ID that they're allowed to leave their homes to purchase foods and other supplies needed for the interim or for the duration of the quarantine. The government also announced that there should be, it is allowed to have delayed payment in house rent, electricity bill, water bill, internet connections for the duration of the quarantine, which also helped a lot of people and businesses. And some government institutions, the Department of Social Welfare and some local government, gave assistance to their the people they are what you call this they're people of responsibility, like for example cash or food allowances, and sometimes for burial and crematory assistance. Now this is a website created by the University of the Philippines, and you can see that by March and April, this was the epidemic curve. And after the community quarantine, we can see that the amount of infected people daily was decreased. So showing that the quarantine measures were effective in flattening the curve. Now, what are the notable actions? One of the notable actions that I would like to share to you is that the University of the Philippines developed its own RT-PCR test kits that are 8 times cheaper than the international ones previously used. So this was launched, I think, late March and early April. And so this is 8 times cheaper than the international counterpart. And the University of the Philippines created what we call the UP COVID-19 Pandemic Response Team. So it gathered together all the campuses, all the experts in their different fields, may it be mathematicians, may it be epidemiologists, may it be nurses, doctors of medicine, all the strengths of the college, of the university, and put them all together in one team to troubleshoot the existing pandemic in the Philippines. And one of their outputs is this website, which is what we call the ncov.ph. No? So at present, this was a screenshot of today's status in the Philippines. So as of now, we have 29,400 confirmed cases. We have 1,150 deceased cases, and we have 20,600 active cases at present. Also, another output of the university is quarantine and lockdown is damaging to the economy. So they did a study, they did job risk analysis, and they identified what types of job are high risk spreaders and low risk spreaders, and high impact to the economy and low impact to the economy. And this is their findings. No? So we could allow the following: farm workers, tellers, computer systems engineers, construction workers, although they have high impact to the economy, although they are high risk what do you call this? Low risk transmitters, this group of people can be allowed to resume their operations. Whereas we have this high risk spreader but low impact to the community, like for example, the hairstylists, the recreation workers, the actors, they should never go back to work at this present. While this graph A and D, they could actually do online jobs. No? So this is how we analyze how the economy could gradually return to its operation. Now, after the community quarantine, the university also advised a gradual lifting of the quarantine. So we have what we call the general community quarantine, we have the enhanced, and we have the modified enhanced, and we have the modified general community quarantine. It depends on the status of each city or community. So it's not total lockdown on all places. So I think that is my presentation. Back to you, Professor. Thank you.
Thank you very much, Carlos. It's a very interesting presentation. I think the Philippines has many different and unique features in responding to the COVID-19 pandemic through the community participation, and also the very important role of the University of Philippines, Manila, University of Public Health. Your university is very impressive.